My name is Dr. Sanjeev Bagga. I am going to be talking today about anterior knee pain. My acknowledgements to the American Academy of Orthopedic Surgeons. These slides are only for patient education purposes. Um, a few words about knee anatomy. There are four bones that make up the knee joint, namely femur, which is also called the thigh bone, which is a big bone in front of your thigh. The next bone that is a part of the knee joint is what is called tibia or shin bone. Next to it is a bone called fibula, which is on the outer aspect of the knee joint. And then there is a bone which is seen in front of the knee joint, which is called patella or kneecap. The patella is held in place by the quadriceps tendon, which is holding the patella in place along with the patellar tendon. Now, quadriceps tendon is made by the quadriceps muscles, and it plays an important role in the knee pain, which is felt in the anterior aspect of the knee. Now, why do we have pain in the anterior aspect of the knee? It is because of inadequate stretching and strengthening exercises. By resting, by taking over-the-counter pain medication and strengthening exercises, one can relieve the anterior knee pain. A few words about the role of quadriceps muscle. If these muscles become weak, then they are no longer able to hold the kneecap in place, which leads to poor tracking of the kneecap within the groove, and then the consequence is that there is extra stress on the tendons, namely the quadriceps tendon and the patellar tendon, which leads to tendinitis, and then of course irritation to the cartilage which lines the undersurface of the kneecap or patella. Now, the patients typically experience dull achy pain. They also experience popping or crackling sounds in the knee when they climb stairs, or after prolonged sitting they want to stand up or walk. They experience pain at night and pain during activities which involve repeated bending of the knees. Very simple treatments, namely rest when you're having pain. Certainly, you have to stay active, and so strengthening exercises and stretching exercises are a must. While you are experiencing pain, you can use ice, which you should not apply directly on the skin, but either put the ice in a towel or in a plastic bag and then put it on the knee joint for approximately 20 minutes, or at least 20 minutes. Um, One can use painkillers such as ibuprofen and naproxen. Remember, they should never be taken empty stomach. There is a separate video that I have made for knee exercises, but one knee exercise that is very important for quadriceps stretching is where you see this reclining, semi-reclining man, where he's put his weight on his elbows and bent one knee in this fashion, and then he's raising his leg up, holding it for a few seconds or as long as possible, then bringing it down and repeating this over and over again. So these are the few steps that you can do to take care of your knee